Now, more men get tuberculosis than women, but what are the reasons for this? University of Cape Town Centre for Infectious Disease, Epidemiology and Research has identified some of these factors. They include HIV, antiretroviral treatment uptake, smoking and heavy drinking. Despite interventions in TB control, South Africa remains one of the 6 countries that account for 60% of infections in the world. To discuss this further, we're joined by UCT researcher Mmamapudi Kubjane. Thank you so much for joining me, Mmamapudi. You know, this is quite scary if you think about it, and there are probably a number of factors that play a role here. But why is it that men are more prone to get TB than women?
Yeah, thanks for having me and for your interest in our study. Yeah, as you mentioned, there are multiple factors that drive TB, and in particular TB in men. These include factors such as tobacco use, smoking, or alcohol misuse or heavy alcohol intake, and undernutrition and lower health care seeking patterns such as testing for TB when you experience symptoms and HIV testing. And there are multiple barriers that cause these. For instance, having to go to work and the time lost when you have to visit healthcare facilities. And the way that these factors are distributed in the population are much heavier in men, contributes to the much higher TB incidence and mortality that we observe. And from our studies, the modeling that we do, we estimate, yeah.
And what would you say, is, still TB is still widely recognized as a disease that is, driven, or it's the reasons for it. It could be socioeconomic circumstances. Is that still the case?
It is very much the case, indeed. For a long time, we have acknowledged it to be a socioeconomically driven disease. So people of lower socioeconomic status are more likely to experience TB and TB-related costs. And however, our TB control interventions have largely been biomedical, and these interventions are effective and do contribute to reducing the burden of TB. However, it does seem that they do need to be complemented by actually addressing these socioeconomic factors. For example, in the study, we have also estimated, for example, undernutrition contributing to TB incidence much more in men than females, but at a population level, it does drive TB. And but there are also access barriers, so much poorer people would be less likely to access health facilities promptly, and this continues to drive transmission. So the main message from these findings is pointing to the need to actually complement the current interventions that we're having in order to see substantial reductions in TB incidence and mortality going forward.
Let's talk about these interventions. I mean, despite the progress that South Africa has made in controlling TB, there is still a big need for some much-needed interventions, seeing that South Africa is still, one of the top 6 countries in the world when it comes to TB cases.
Yeah, so, I mean, the interventions that so we did the study that estimated the impact of multiple interventions over the 30-year period from 1990 to 2019. And the most effective, mainly the biomedical ones, have been antiretroviral therapy. So that still remains a key intervention because we have high rates of TB, of HIV in the country. And also finding patients with TB, they remain key, and they've contributed significantly to reducing TB. But going forward, like when we, were you asking something?
Yeah, no, just very shortly, actually. I just want very lastly for you to answer, the interventions that should be specifically made to target the male TB or males that have TB. So should there be more resources allocated for those interventions?
Yes, so what we're suggesting is that there needs to be investment in interventions that actually target men to be able to access TB care much more promptly and also for HIV care. So this can be, for example, making mobile clinics at work places or making it within our health facilities, making male-friendly services that would incentivize men to actually go to health care facilities and seek care when they experience symptoms or also for HIV testing.
All right, thank you so much. That was UCT researcher Mmamapudi Kubjane.